Every 40 seconds, somewhere in the world, a person's life changes forever. Don't think stroke affects only old people. Stroke in people under 50 has increased by nearly 25 to 40% in the past 2 decades. It starts silently, a sudden weakness in the arm, a slurred word, a moment of confusion, and within minutes, the brain begins to die. A stroke is one of medicine's true emergencies. It strikes when the brain's lifeline, its steady flow of oxygen-rich blood, suddenly fails. The brain is a restless metropolis that never sleeps. Billions of neurons fire every second, coordinating movement, thought, emotion, and memory. This city thrives only when its highways of blood vessels stay open and clear. When that supply chain is interrupted, even briefly, brain tissue suffocates. Within minutes, cells begin to die, and the functions they control, speech, movement, vision, memory, start disappearing. In medicine, there are few conditions where time matters more than this. Stroke is one of those conditions. Every minute lost means roughly 2 million brain cells gone. That's why we say, with no exaggeration, time is brain. Stroke isn't a single disease, it's a crisis with 2 very different faces. The first, and most common, is ischemic stroke. Picture a traffic jam inside the brain's blood vessels. A clot forms, often breaking off from the heart or a carotid artery, and suddenly a vital roadway is blocked. Blood can no longer reach the neurons waiting downstream. Deprived of oxygen, they begin to shut down. The lights of the city start going dark. Then there's hemorrhagic stroke, a much rarer, but often more devastating event. In this case, a blood vessel doesn't clog, it ruptures. Blood spills into the surrounding brain tissue, creating chaos, lost circulation, rising pressure, and swelling that crushes healthy cells. In ischemic stroke, the problem is blockage. In hemorrhagic stroke, the problem is bleeding. But the result is the same, brain tissue is starved, and seconds matter. Sometimes, the brain gives a warning before disaster strikes. It's called a transient ischemic attack, or TIA, a mini stroke. During a TIA, a small clot temporarily blocks blood flow. The symptoms, weakness, slurred speech, vision loss, look identical to a stroke, but they fade within minutes or hours. People often breathe a sigh of relief, thinking, "I'm fine now." But that relief is dangerous. A TIA is not harmless. It's the brain's alarm bell, warning that a major stroke could be hours or days away. About 1 in 3 people who have a TIA will suffer a full stroke, many within the first 48 hours. Think of it as a preview of a disaster that hasn't yet happened. The smart response is not relief, it's immediate medical attention. Let us compare TIA with stroke. We will look at both conditions regarding the duration, amount of brain damage, anticipated symptoms, and the urgency of brain damage. TIA lasts minutes to less than 24 hours. Stroke lasts longer, often permanent. Stroke results in brain damage. In TIA, there is temporary blockage of blood flow to brain tissues. In stroke, cells die within minutes. TIA symptoms same as stroke, but TIA resolves fully. Stroke symptoms, persistent or worsening. TIA urgency, high predictor of future stroke. Stroke, emergency, damage occurring. You can't tell a TIA from a stroke in the moment. That's why every episode, no matter how brief, deserves the same response: get emergency care immediately. The first signs of stroke rarely come with warning. They appear suddenly, mid-conversation, mid-meal, or even mid-sleep. You might notice the corner of your mouth drooping. An arm or leg might grow weak or numb. Speech may become slurred or confusing. Your vision might blur or vanish in one eye. Some describe feeling as if the world tilted sideways, dizzy, unsteady, unable to walk straight. Others experience a blinding headache, unlike anything they've ever felt. These are not moments to wait and see. They are signals of a brain under attack. Every minute counts. That's why doctors teach the acronym FAST, F, face drooping. Ask the person to smile. Does one side droop? A, arm weakness. Ask them to raise both arms. Does one drift downward? S, speech difficulty. Is speech slurred, strange, or absent? T, time to call 911. Don't drive yourself. Don't wait. Don't assume it will pass. Emergency responders can begin life-saving care even before you reach the hospital. Why is time so crucial? Because modern medicine can reverse a stroke, but only if it's caught early. For ischemic strokes, powerful clot-dissolving drugs can reopen blocked vessels, but they must be given within hours. For certain cases, specialists can thread catheters directly into the brain's arteries to remove the clot, a procedure called mechanical thrombectomy. Both can save lives and preserve function. But both depend on speed. Studies show strokes often strike in the early morning hours, between 6 a.m. and noon. As the body wakes, blood pressure rises and blood becomes stickier. For people with risk factors, high blood pressure, diabetes, heart disease, this period is especially dangerous. Recognizing symptoms early, and acting without delay, can mean the difference between walking and lifelong disability. The best treatment for stroke is prevention. And prevention begins with the choices you make every day. Start with your plate. Fruits, vegetables, and whole grains protect blood vessels. Foods rich in fiber lower cholesterol, minimum sugar and salt in processed food. Limiting salt helps keep blood pressure in check. Avoid trans fats and excess saturated fat. These clog arteries and feed the silent buildup of plaque. Use olive oil. Think of each healthy meal as a small investment in your brain's resilience. Next, movement. You don't need to run marathons. Even brisk walking for 30 minutes, 5 days a week, lowers stroke risk by up to 25%. For children and teens, an hour of daily play builds lifelong protection for the heart and brain. If you smoke, stop. The same goes for vaping. A 2024 analysis in the New England Journal reported similar odds of cardiovascular disease, including stroke, for exclusive vapors and exclusive smokers, with higher odds in dual users. Smoking damages blood vessels, thickens blood, and doubles your risk of stroke. If you've never smoked, keep it that way. If you drink alcohol, do so in moderation, no more than 1 drink a day for women, 2 for men. Each of these habits, eating well, moving often, not smoking, may seem simple, but together they form a shield. Not all risks can be seen or felt. High blood pressure, high cholesterol, diabetes, and heart disease often work in silence, quietly damaging arteries for years. That's why regular checkups matter. Have your blood pressure checked at least once a year. Better yet, measure your blood pressure regularly at home. Learn how to measure it correctly. Test your cholesterol at least every 5 years for healthy adults, or more often if you have high blood pressure, diabetes, obesity, a family history of early heart disease, or you're on cholesterol-lowering medication. Uncontrolled diabetes weakens and narrows blood vessels, making clots more likely. If you have atrial fibrillation, an irregular heartbeat, discuss treatment, because clots from the heart are a leading cause of stroke. And if your doctor prescribes medication, take it. Skipping doses can undo months of progress. Medications for blood pressure, cholesterol, and diabetes don't just manage numbers, they preserve neurons. Even after a stroke, the story doesn't end. The brain has a remarkable ability to heal itself, a process called neuroplasticity. With rehabilitation, speech therapy, physical therapy, occupational therapy, many people regain independence, mobility, and confidence. Family support and early rehab are critical. Every exercise, every word practiced, helps new neural pathways form. Recovery is never instant, but it is possible. Preventing a second stroke uses the same formula: control blood pressure, stay active, eat well, and never ignore symptoms. Each healthy choice you make is not just about avoiding disease, it's about reclaiming your power over time. A stroke begins in seconds, and its outcome is measured in minutes. Those minutes can decide whether a person walks, speaks, or remembers who they are. But with awareness, action, and prevention, we can rewrite that story. When you know the signs, when you act fast, you don't just save a brain, you save a life. Your own, or someone else's. Because in the fight against stroke, every heartbeat counts, and every second truly matters. The materials are from my recent book. If you find the video helpful, please like and subscribe. Thank you.